So I'm asking you, will you support Congressman Conyers' plan, H.R. 676, to provide universal health care to everyone in the nation?
Pat, I support universal health care. I mean, plans are developed, there are modifications and amendment, but whatever drives a national plan, I think the federal government needs to tackle this on a national basis, and I support universal health care on a national basis. Whoever is sponsoring legislation, I certainly want to be a governor because of our leadership in the state of Maine and Dirigo, you know, because we are limited by what we can and can't do. I want to see the federal government tackle this and give Maine the latitude to take the training wheels off and offer competition in health care. So I just support any initiative that would do that at the federal level.
So we can contact Congressman Conyers and have him put you on
I know
the
John
list?
Conyers. I'd support his effort. I haven't seen all the particulars of his legislation, but I'd support his effort.
Pat and I have talked about this quite a bit. We have certainly been together in probably 30 forums throughout this campaign season. And I admire Pat for her compassion in advocating for universal health care, but it is clear that the federal law won't allow it. It's simply not practical for Maine to do it, as compelling as it is, and certainly a lot of us wish that we could solve the health care crisis all by ourselves here in Maine.
I think the only possibility we have for single-payer health care, universal health care, is at the federal level, and we've talked about this before. It's important that we examine the bill before we are able to support it or not. I mean, at the federal level, the riders they attach sometimes puts the bill in a different perspective. We're comfortable with the effort. If we're going to have a federal program, it needs to be supported initially, but we can't have it in Maine. We can't afford it in Maine.
Well, I disagree that it can't be done. I think we can do it here in the state of Maine, and the way that I see universal health care for all of our people, for their teeth, their eyes, every part of the body, that is to do away with the income tax, bring new businesses into the state, and raise the use and sales tax to include all the services and goods that we produce in the state of Maine. We're more of a service community now than a goods producing community, and we have to get on the new ticket to do new things and doing it in a different way. But the job is get her done.